Hi, I'm Dr. Geeta Bidansing, and I would like to talk to you a little bit about diabetes and coronary artery disease. If you are watching this, then likely you are a newly diagnosed diabetic patient. You may have, or you've had diabetes for some time. You know someone with diabetes. You just want to find out more about diabetes and heart disease. So, what is diabetes? Diabetes is a condition which causes hyperglycemia or high blood sugar. There are many types, but the most common is type 2 diabetes. High blood sugar, in this case, is caused by either the body not producing enough of a hormone called insulin. You are producing some insulin, but your body is not responding to it. There is increased production of glucose or sugar by the liver, and there's a decreased ability of the body cells to pick up the sugar. So what happens? Easy way to think about this is to think of a car, and you need to put gas or petrol in the car, which is then burned in the engine to produce energy for the car to run. In a similar fashion, people need to eat food, which is then broken down into simple sugar. The simple sugar is then taken up by the blood cells, by cells of the body, and this process is facilitated by insulin. Once the cells take up the sugar, it is converted to energy, and you have energy to run and live. In diabetes, however, the hormone, the insulin, it's not being produced in enough amounts, or the cells are just not responding to it in the way it's supposed to. So instead of the cells being able to take up the sugar or the glucose, it remains in the bloodstream, and that's what causes the blood sugar to be high. So a lot of times when you go to the doctor and you do blood tests, they will measure the value. And if you've had a blood sugar level reading more than 200 milligrams per deciliter on more than 2 occasions when you did the blood tests, and this is just a random reading without you having to fast, or you just had that random reading and symptoms, then a doctor would say this is diabetes. Or doctor might ask you to fast, meaning don't have anything to eat or drink for at least 8 hours, and then they will draw some blood from the vein. And if this value, the amount of sugar, is more than 126 milligrams per deciliter, when they draw it, either on 2 separate occasions, or if you have symptoms and you have one abnormal reading, then the doctor could diagnose diabetes. So we talk about symptoms. Some of the symptoms are feeling tired or sleepy because your body isn't able to use the glucose for energy. There's frequent urination because this is how the body gets rid of the excess sugar in the bloodstream. Some diabetics find they feel extremely thirsty, they feel more hungry than normal, some may experience blurred vision, and some may not recognize any of these symptoms or have any of these symptoms and may have been diagnosed as an incidental finding because they saw the doctor for another reason, or maybe they went to a health fair just to get checked out. So, why treat? You may be wondering, if you saw the doctor, you had symptoms, you got some medication, and now you feel fine, you don't have those symptoms anymore, or you don't have any symptoms at all, why do you have to take all of these pills? Why are you on medicine to treat blood sugar? Why are you on other medications that not necessarily for sugar when you feel fine, you have no symptoms? And the reason why we treat is because we know that patients with diabetes can develop what we call complications. Some of the complications can involve the eye, the nerve of the eye, or the kidneys, and these are what we call microvascular complications. Some may involve organs like the brain, the heart, or may involve the blood vessels that go to the legs, and these are what we call macrovascular complications. The macrovascular complication that I would be focusing on in this presentation is coronary artery disease, which usually gives rise to things like angina or myocardial infarction, or what is commonly called heart attack. So Complications can develop in patients who are diabetic, especially patients who've had diabetes for a long time. Many patients who are diagnosed with diabetes, by the time of diagnosis, they've usually had diabetes for about 10 years without realizing it. Or some of them may have had a condition we call prediabetes, where the sugar is not high enough to be considered diabetic, but not low enough to be considered normal. And this condition in itself is a risk factor for coronary artery disease. So again, this is why it is important to treat. Whether you've been diagnosed recently and you've only known about your diabetes for a few weeks, or if you've had diabetes for a long time. So we mentioned coronary artery disease. So the first thing we should do is try to understand what the coronary arteries are. Coronary artery is just another term for the blood vessels that supply the muscles of the heart. The heart is the organ that beats to supply blood to the whole body, and blood is important for life. So you can think about the arteries like a pipe, where there's a big space in the center through which blood flows, and that's good. That's what you want, because you want the blood to be flowing. So sometimes what happens, especially in patients who have diabetes, something called a plaque could start to develop in the arteries. And the plaque is basically made up of cholesterol and white blood cells. And the plaque eventually starts to narrow the space or the opening in the artery, kind of like how a pipe can get clogged up. And this reduces the amount of blood that flows through, so that the muscles does not get enough blood. In some cases, this plaque could break apart and release substances that will cause the blood to clot at that site, and then the blood supply is drastically cut off. When these things happen, patients experience the symptoms of angina or myocardial infarction. Angina is really just chest pain, and it usually happens when the blood supply is cut off for a brief period of time, but it's not long enough to cause the heart muscle to die, versus myocardial infarction or heart attack, which is where the heart is deprived of blood and the muscle of the heart actually gets damaged. Part of it actually dies, right? And that's actually the more serious complication. So, risk of heart attack. We said that having diabetes puts you at risk of a heart attack, and having prediabetes is also a risk factor for heart attack. This is because the high blood sugar could actually cause inflammation in the blood vessels and make it easier for those plaques to develop. Patients with diabetes might also have other risk factors, such as high cholesterol, high blood pressure, may be obese, they may also be smokers, and they may have family members who have heart attacks, and all of these things combined together can increase the risk. Sometimes your doctor would use what we call a risk calculator, and it looks at all of these factors as well as your age and your gender, and it can give you what your risk for developing a heart attack over a period, usually 10 years. It can calculate that and express it as a number or percentage. So another thing, when we speak of risk of heart attacks, it's always a lot of people note that men are more likely to get heart attacks, or men get heart attacks at a younger age. And while this may be true, it has led to a common misconception that heart disease is a man's disease, but it really isn't. Heart disease can also affect women, and especially women with diabetes. Heart disease is the leading cause of death in women. Women with diabetes who've had a heart attack are 2 times as likely to have another heart attack, 4 times likely to develop a problem where the heart muscle doesn't work right and fails. In women, having diabetes and having prediabetes actually increases your risk for heart disease more so than it would in a man. And women tend to have worse outcomes when it comes to heart attacks, either because of a delay in diagnosis, delay in treatment. So this is very important as for female patients to be aware of, that they are at risk of a heart attack. And this is one case where, being female may not be something that would protect you. So what can you do? If you're diabetic, can you do something to prevent or reduce this risk? And some of the things that your doctor would help you to do to reduce this risk would be trying to maintain good glycemic control, manage other risk factors. If you smoke, they would advise you to stop smoking. And if it is something that you are ready to do, they would be able to help you to do that. And they may also put you on certain medication that has benefits for the heart as well. So, what is good glycemic control? So, good glycemic control is essentially just another way for us to say that we're treating your diabetes and your blood sugar is controlled. We get evidence that these things actually help the heart by doing studies. And especially we try to do large number of studies and combine the results so that we know whether this is going to be effective or not. So different studies have shown different things. But the conclusion is that having good blood sugar control may actually help to reduce your risk, and especially in patients who are newly diagnosed with diabetes, who haven't had diabetes for a long period of time. However, it is important to know that your blood sugar needs to be kept within a certain range. Too high is bad, but too low can also cause problems with the heart. So preventing something called hypoglycemia is especially important, and especially in older patients. Self-monitoring of your blood sugar, therefore, would be very important, especially if you're on insulin. And other tools, such as the A1C, is something else that your doctor could use to determine if the blood sugar is controlled. So, if you are monitoring your blood sugar at home, your targets, fasting before you have anything to eat or drink, usually in the morning, should be between 80 to 130 milligrams per deciliter. 2 hours after eating a meal, your sugar should not rise beyond 180 milligrams per deciliter. Some patients, doctors may choose to have lower targets, and in some patients, doctors may choose higher targets depending on a patient's age and if they have other illnesses. In terms of the A1C, which we were talking about before, A1C is a good way to determine if the blood sugar has been properly controlled over a period of time. And it's important to know that every 1% rise in the A1C increases the mortality from cardiovascular disease. So this should be kept within a specific target. Ideally, the aim would be to achieve a value of less than 7%. Younger patients who've had diabetes for a shorter period of time, it might actually be better to go even lower, less than 6.5%. Older patients who've had diabetes for quite some time, who may have other problems or other complications, may not be able to tolerate this, and they may not do so well if we try to push them to that. So doctors may choose a higher goal, usually around less than 8%. Blood pressure, which is another risk factor. Most patients who are diabetics would be advised to try to maintain a blood pressure less than 140 systolic, which millimeters of mercury, which is the one on top, the reading on top, and less than 90 diastolic. Some patients may again be advised to go even lower, to aim for targets of less than 130 and less than 80. Cholesterol. If you have high cholesterol, your doctor would advise you to try to reduce this. And the first thing they always advise is eating a healthy diet and trying to exercise regularly. Some patients might even be placed on specific medications called statins to help lower the cholesterol. So 4 groups of patients generally benefit from statins, and these are those patients who've already had heart disease or heart attacks, those patients who has an LDL, which is your bad cholesterol, of more than 190 milligrams per deciliter, all diabetic patients between the ages of 40 to 75 whose cholesterol is between, the bad cholesterol, the LDL, is between 70 to 189, patients age 40 to 75 who are not diabetic and whose cholesterol is within that range, but have a 10-year cardiovascular disease risk of more than 7.5%. Smoking, which again, another risk factor, is associated with an increased risk of cardiovascular disease. Compared to non-smokers, women who smoke have an increased risk of heart attack 2.4 times more than the non-smoker. And in men, that risk is increased 1.4 times compared to a non-smoker. So stopping smoking can reverse this risk. And the beautiful thing about this is that the benefit of smoking cessation is almost immediate. Exercise and weight loss. As doctors, we're always trying to advise our patients and get our patients to get moving, to exercise, and if you're overweight, to lose weight. The organizations such as American Diabetes Association advise that you should aim for at least 30 minutes of moderate to vigorous intensity aerobic type exercise, so running, jogging, things like that, at least 5 days a week. You try to space it out, over at least 3 days during the week, and try not to go more than 2 days without exercising. With regards to weight loss, modest weight loss, as low as 5% of the body weight, of your baseline body weight, can actually improve your cardiovascular risk profile. So most of the time, we say aim for a slow and steady weight loss rather than trying to worry about dropping the weight really fast. Other than modifying those risk factors, there are certain drugs that your doctor would want to put you on that could reduce your risk of heart attack. We've already mentioned statins and the 4 groups of patients that will benefit from being on a statin. And it's important to note that independent of cholesterol, this drug actually can help to reduce inflammation in the blood vessels that supply the heart and reduce the risk of heart attack. So even if you think your cholesterol isn't bad, or if you've been on a statin and the cholesterol is down and you think, okay, well, it's down now, I could stop it, or I just want to eat oats and a healthy diet, regardless of what your cholesterol is, there is some benefit to statins beyond just the cholesterol. So it is important to take it once it's prescribed and you're not having any side effects, or the doctor doesn't stop it for any other reason, right? You still have to adhere to the healthy diet and the exercise. Nothing is wrong with that, but the statin is actually very, very useful even beyond your cholesterol. Another group of drugs is something called the ACE inhibitors, or there's another class called ARBs, or angiotensin receptor blockers. And these are a class of drugs used to treat high blood pressure. They are especially useful in diabetic patients. They protect the kidneys, but they also does reduce your risk of ischemic heart disease. And it's very important that patients who have had a heart attack actually be on these drugs, even if the blood pressure is normal. There are benefits beyond the blood pressure effect. Another consideration is aspirin or antiplatelet drugs. We mentioned before that sometimes you can get clots forming at the site of a plaque that breaks inside a blood vessel, and the role of aspirin is to try to decrease this. So all diabetic patients who have an increased risk, usually more than 10%, should be on aspirin unless there's a reason for them not to. In some cases, some doctors may even consider aspirin for patients with intermediate risk, which is those that fall within a risk category of 5 to 10%. Women, and the ADA does recommend aspirin for women as well, more than 30 years of age, who have diabetes and who have one of the following risk factors. So either a family history of heart disease, women who smoke, who have high blood pressure, who are overweight, who have evidence of protein in the urine, and who have abnormalities of the cholesterol. So both men and women will benefit from aspirin if they have risk factors for heart disease and diabetes. So this is important. So take home message: diabetes and prediabetes can increase your risk of heart disease. Risk can be reduced by a healthy lifestyle. Your risk could also be reduced by controlling your blood sugar, your blood pressure, your cholesterol. Aside from lifestyle changes, which is very, very important, medication could also help in controlling these risk factors. And the medication may actually have benefits to protecting your heart beyond the obvious. So even if you think your pressure is good, your cholesterol is good, it may be important for you to continue taking these medications. Great. Thank you very much for your time.